So we're at the stage where we're trying to push research. We're trying to bring all of the experts and everyone who's looking at this space. It's a public health conversation. It's a planetary health conversation. And in May and April, we started, a webinar series. I see some people who have also joined our previous series before. And in that series, we wanted to open up this conversation. In April, we had Dr. Charles Ogunbode from the University of Nottingham share with us about eco-anxiety in Africa from an academic point of view. In April, we had youth activists from South Africa and Nigeria, Shilot and Lekwa, and they also gave their own perspective as young people who experience eco-anxiety. And in June, we had something even more interesting in Abuja, where we all came together and used poetry as an entry point to discuss emotions. So it was the very first time we had a physical event in the nation's capital. Today, we're doing something also very interesting. We've been very fortunate enough to find a public health expert and a lecturer who's going to be talking to us about a case study from Cameroon. So this is something we've always wanted. How can we talk about this conversation with real life case studies of people in Africa who are being impacted by the climate crisis? And how can we further share this body of knowledge to everyone and make the conversation accessible? So that's all we'll be doing today with these conversations. And we're really, really grateful that we have Professor Kenneth here with us. I would read his bio very quickly. Professor Kenneth Yongabi Achang is a distinguished specialist in public health, infectious diseases, and phytobiotechnology, with several years of working experience consulting with organizations, businesses, and national ministries in Nigeria and Cameroon. He's worked with organizations like the WHO, the UNDP, the UNESCO, and other pharmaceutical companies. Professor Kenneth has over 200 scientific publications, which include books, conference papers, book chapters, and many more. Now, Professor Kenneth's research covers African public health system, where he demonstrates through pilot projects the limino-cultural public health reality required for Africa, Afrocentric health literacy, clinical microbiology, biopharmaceutical and antibiotic development and discovery, as well as the African traditional medical system. He is a lecturer of public health and infectiology at Imo State University, Nigeria, and also an adjunct professor of public health and infectiology at Clariton University of Nigeria, where he also serves as the Dean of School of Health Sciences and director of the only University Center of Excellence for the Promotion of Indigenous Knowledge. So we are very much at home with one of our own to discuss, looking at climate resilience, looking at this conversation of eco-anxiety, climate distress, looking at it from Cameroon, and also looking at it from a public health, African public health perspective. You're very welcome to today's webinar, sir. We're looking forward to having a really good conversation with you. In our audience, we have young people who are passionate about this topic, and also, enthusiasts and experts either within the public health space or the environmental space, looking to, listen to this conversation on the many things we can draw out. After your presentation, we're going to have a short Q&A session where we'll open it up to the public and everyone can also share their questions based on your presentation. Thank you again. You have the floor, sir.
Okay, thank you for that wonderful introduction. And you've set the pace for this workshop or seminar. And I would like to thank you for the work you're doing with your organization. And I also like to welcome all the participants for this. It's not always easy to have people come to listen to you and to have that opportunity to be able to share your thoughts and ideas. I'm very honored, and this is a privilege that I wouldn't take such a privilege for granted. We are all Africans, and we are all Afrocentric. We have the DNA of Africans, and we would need to steer development as Africans. There is a proverb that I learned from a priest, that a monkey and a gorilla in the forest will claim oneness. But when temperatures changes, the monkey will become a monkey and the gorilla becomes a gorilla. So the topic of climate change is all, I mean, it's all encompassing, and it brings all the global, all the continents to the fore. But I would like to say that, you know, we all share the same passion with all the continents. We all have a problem confronting all of us. But I tell you that when the hazards of climate change really comes in, the West will think about themselves first. So a gorilla is a gorilla and a monkey is a monkey. So we have, as Africans, to think about ourselves as well. So we have to design what kind of interventions are suitable for us. And that leads me to this topic, the climate mental resilience-led interventions in Africa and lessons from Cameroon. So I will take you through my slides. You know, well, I think the director of Solstice Vibes has set the pace. So I had to, you know, put these two slides here just to be able to give credit to Solstice Vibe. I'll move to the next slide. I'll just be going to the next slide so you can see. If you don't see the slide, let me know. Is everyone seeing the slides?
Yes, sir.
Yes, sir.
Okay, so climate resilience, climate change, mental health, case studies. These are the keywords that we'll keep at the back of our mind as I navigate this lecture. What are the learning objectives? I want us to meditate. I don't want us to take this as a traditional lecture. I want us to really take this as a lecture that touches our spirituality. So at the end of this session, you will be able to, number one, describe mental health disorders. What is mental health disorders? What is mental health? So as I lecture and I talk about this, also reflect internally about what the whole of this thing we're talking about is, especially the deontology of these words, the conceptual framework of these words. If we don't understand them, we cannot talk about intervention. If we don't understand them, we don't know what to do in the case of facing these challenges. What are mental health diseases? What are other diseases of, you know, related to climate change? Now, of course, even the existing diseases that we do know of would be exacerbated by climate change. What I mean, malaria, typhoid. So we will discuss as we move on. This is just to give you the preamble of what I'm talking about. What is climate change from local, regional, and global perspectives? The local perspectives of climate change. What is your own perspective of climate change? What is the regional as Africans? What is the global perspective? There are areas of overlap, but there are perceptional differences, and I would like us to check as we move on. We have to identify the most vulnerable group of people or vulnerable people and the populations whose health could be grossly affected by climate change and mental health. We are positioning ourselves. The nitty-gritty of our talk is mental health. We want to see how it is affect our psyche. Then we should look at the adaptations. How do we adapt to climate change, related health issues, risk, problems? And then we now go and settle on the interventions that we have taken as a case study to study it, to see how these interventions they work for us to be able to scale up across different scenarios in Africa and of course the world. And that takes me to the next slide. So I've like given you what I expect you to get at the end of this talk. Now the outline of my talk again is, and I like for us, is like concluding my talk at the same time beginning my talk. This is the outline. The theoretical and conceptual framework. The whole world is shouting about climate change. People just wake up from bed and talk about climate change. These things have been there. So why now? Why are we talking about climate change? What has really triggered, what has been able to, what has been the volcano that has really triggered this? There's so much cliche talk on climate change today. Do we really understand it? So what is climate change and resilience? What is resilience? Then what is mental health? So we have the WHO definition of health. So you'll be able to understand that. The level of understanding of climate change so far and its health and economic and social and cultural effects, climate-related disasters. Then we talk about a reality check. How do we know that we are affected by climate change? So words come into mind: eco grief, happiness. We are happy. Are we happy with the scenario? We may be happy that we have money. Are we happy with maybe extreme weathers? Or sometimes when we have money, we don't seem to think about extreme weather. But when we're really in the midst of extreme weathers, we are happy and joyed with our money, our aggrandizement, our wealth. Do we think about this? Depression, stigma, anxiety, and I like to focus on the word eco-anxiety, eco-psychosis, eco-trauma, post-traumatic disorders, distress, sadness, shock, psychosis, and somatic diseases. I mean, we've just so much to talk about, but I would just, narrow myself to a few things because we've done a lot, really, over the years, on these issues. Then the existing support mechanism that exists in the West to tackle climate change disorders in terms of how it affects mental health. How does this, support structures, are they in existence in Africa? Then interventions, what I call climate literacy. Do we really understand, climate issues? Not to talk of how it affects mental health, and not to talk of how we need to solve this problem. So mapping out these evidences and so on and so forth. So move to the next slide. So for us to talk about how this affects mental health, and I'm going to narrow it down to mental health because that's the nitty-gritty of our topic. But there's a whole lot of how, if we want to look at it holistically, and which truly it's a systemic issue. Touching mental health also touches physical health, touches psychological health, touches social health, community health. So it's all a one globe issue, and we cannot treat them in isolation. But of course, I would like to be able to narrow down to just to mental health, which is sometimes very difficult to narrow down because at the end of the day, there are so many issues: physical, psychological, perceptional, that would all accentuate to mental health disorders. So I want us to look at it as a system thing, a systemic issue, and not a linear issue. So what is climate change? Let's understand the climate change issues, the gross effect of it, before we see how it affects our mental health, and before we see how we can now look at the kind of interventions we need. Because if we don't understand this conceptual framework, what it is, I mean, there is certainly no way we can have effective interventions. So this slide in front of you tells you about the mortality-related climate change, as produced, published by WHO. So look at that. So you see Asia. We're going to spend more time on that. So you look at North America and Europe. If you go to the key, you realize that these are areas of mortality per million. If you look at that, and if you look at mortality, 0 to 2 are those painted. Some are light, I think light green there, shaded light green. And then if you come to look at where Africa, let's look at Africa. Africa is in red. So they're putting 70 to 120 cases of mortality related to climate change problems and so on and so forth. So Africa is grossly affected in that sense. Okay. Now, climate change vulnerability. So if you look at the graph, I mean, the map in front of you, it shows you the areas that are very highly vulnerable and least vulnerable areas. We're going to delve into that. That could be another topic for another day, to look at what are the factors that are actually predisposing to such vulnerability. So we look at the next slide. Global warming impacts on climate and risk factors. These are the risk factors. What is global warming? We are all, experiencing in certain conditions heat waves, frequent heat waves, that some seasons, I mean, the dry season is becoming hotter, and longer in some cases, landslides, flash floods, reduced water availability. All these things are things that are all perpetuated by climate change. Now, climate change impacts on health increase in climate sensitivity and health outcomes. So look at that picture in front of you. This is taken from Asia, but we have these issues also in some parts of Africa. So the direct effect, injuries due to prolonged heat, scorching sun, this leads to sometimes disability. And then sometimes because of prolonged rain, flooding, you have drowning. Of course, with heat, you have heat stress. Now, indirect effect, water and foodborne diseases are also increasing. Malnutrition, vector-borne diseases, and of course, psychological stress. These are just a general outline of that. Now, Southeast Asia region is vulnerable to climate-sensitive heat stressors. So this is just a report that has been given. But then, of course, in this case in Africa, Africans are resilient to this in the sense that we are in the tropics, we are in the equator, and if you look at the Sahara Desert, the Kalahari Desert, I mean, these are very hot areas that are already naturally there. Not talk of climate variability actually prolonging this heat and the longer dryness and all that, semi-arid and arid areas and all that stuff. Okay, so we are already quite used to that, unlike some of the continents. So the picture in front of you again shows heat-related morbidity and mortality. What is morbidity and what is mortality? When you talk about mortality, deaths, actual number of deaths due to climate-related issues. Morbidity, sicknesses, inability to be normal, to do the usual chores that you want to do, having a headache, having a stress, running a temperature and all that. We all classify that in public health as morbidity. So these are areas that are still virgin in terms of quantification. Sometimes with issues of climate change, you have heat rise, heat cramps, heat exhaustion, heat stroke, and all that. As you can see from that picture. So I'll rush you through again from here. Human exposure to tropical cyclones. You've heard of tropical cyclones occurring in parts of Asia, occurring in parts of North and South America, So if you look at the graph there, just to put the context there for you to can see statistics, that from 1970 to 2030, look at what has been estimated. But you can see that these tropical cyclones are not really a big or major issue on the African continent. And we have to keep that in perspective, especially when we're also designing interventions. Now, human exposure to floods, 1970 to 2030. So you can look at that in front of you. I'm not going to delve again on that because I'm going to focus a lot on interventions. Now, generalizations about climate change, vulnerability of human populations. So it gives you that. So just take note of that. I'm not going to spend time on that. But what I will spend a bit more is on vector-borne diseases, because we are in a malaria endemic area. We're also in a typhoid endemic area. And so when there's climate change and climate, disorders, what happens is that we have, frequent bouts of malaria attack. We have prolonged typhoid and different new strains of these waterborne diseases coming up. And ultimately, you may ask me, how does it affect mental health? Just imagine that you keep having malaria attack. And that's what is obtainable right now, especially in our society. It affects your mental health. You start wondering, why am I always sick? Why is my household always sick? So it leads to sadness, it leads to distress, it leads to some form of depression in a way if it prolongs. And those are, the indirect effects of climate change on mental health. Through increased malaria attack, through increased, and frequent recurrent typhoid infection and all that stuff. So that is very important. How vector-borne disease and waterborne diseases due to climate change can affect mental health. I'd like for us to see that linkage there. And that's why I said we have to treat this topic from a systemic point of view, rather than from a linearity point of view. And that's very important. So climate change and mosquito-borne diseases. So if you look at my graph, you see that you expect a normal rainy season. But when the rainy season prolongs, what happened? Mosquitoes breed more. That is it. And that's what happened. That already corroborates with increased malaria attack. And if you do a very simple reality check, you will see that you check medicine stores and chemist stores, you will see that they are buying more malaria anti-malarials in this in the pharmacies and more prescriptions within rainy season. Can you imagine? So if we have a prolonged rainy season, like in some of the cases that we do observe in parts of Africa, then you find that more money goes in for buying anti-malaria. So, and mostly it's out-of-pocket expenditure because we don't have proper health insurance properly arranged in sub-Saharan Africa. So again, what happens when you don't have this money? You go into stress, you go into some form of grief. And this grief, we can call it, you also become anxious, and that's anxiety, because it is related to change in climatic conditions. You can call that eco-anxiety, you can call that eco-stress, you can call that eco-grief. So these are the connections that I want us to look at that. So birds, mosquitoes, viruses, that's something we can talk again another day. Who bears it the most? Climate change impacts the continents differently and in different proportions. That's a take-home message. The way it affects Europeans or the Western nations, it's not the same way it's affecting Africans. So let's take that message. For example, cyclones in North America, Europe, Asia, Australia. We've heard about that. If such cyclones in that magnitude attack Africa, that's going to be like a Holocaust. But we've been hearing of such cyclones, cyclone A, B, C, attacking areas in Texas, in Houston, in the US, running down electricity, cutting down, waterways and all that stuff. If that happens in Nigeria, tell me with the situation, tell me how we're going to cope with. Now, floods, we heard of floods in Queensland, in Australia, Europe, like what happened in Germany. If that kind of flood in that magnitude occurs in Africa, how do we respond to that? So that's why I'm saying the climate change impacts the continents differently and in different proportion. Now, the impact and response is also different in terms of the continents as well. The Western countries respond better than the low and medium income earning countries. And why? This is because of socioeconomic determinants and infrastructure. The socioeconomic determinants of Africa are different from those of Europe. Those of Europe, they already have a structure, the government, insurance, and all that. They are in place, support structures to deal with these kinds of problems. But we don't have that well organized in Africa. So that simply means that if we want to talk about response to climate change effects in Africa, we must develop an Afrocentric approach. That means the approach must be built on the socioeconomic determinants, must be built on the kind of infrastructure that we have. If we want to take and copy what the system in Europeans that they've put in place in terms of dealing with this situation, we cannot deal with them here, because at the end of the day, that means we have to get money from them, apply for grants from them in order to sustain that. That's unsustainable. So interventions in Africa must be built on the socioeconomic determinants and infrastructure in Africa. That is key number one. And that is why we built that particular setup project in Cameroon, using the socioeconomic determinants. And then you're going to see exactly how that works. Now, the key critical three elements or three terms that summarizes the impact of climate variability on mental health is captured below. Look at that. So what we realize for us in Africa and for us in our society here, depression is not even a major issue. Anxiety, yes, we get anxious, that is clear, a problem. Sadness, yes, sadness is one of the major things. Along the line, you're going to see how I've done some rough classification on that. But I'm saying that these are the key, eco challenges in terms of our mental health in Africa. So if you look at the table in front of you, the figure right there, you will see I caption is this figure below, taken from a publication from Nature. The description of climate anxiety holds true for all communities globally. Anywhere in the world, that anxiety will come in, especially when you know that the meteorological surveys have already forecast that there's going to be a cyclone. Tell me, and that cyclone is going to affect this particular region. Wherever you are there, definitely you're bound to be anxious. You're bound to start thinking, if this thing occurs, I'm going to be homeless. Where do I go? I'm going to be internally displaced. So all those things, they affect your brain. They affect your psychomotor. At the end of the day, your nerves, there's that stress that comes up. You even go to neuropsychosis. You even go to neurodegenerative diseases. Just thinking about the process when the event hasn't happened yet. So that's why we call anxiety, and that affects everywhere. No color. It doesn't affect. It doesn't depend on religion. It doesn't depend on color. It doesn't depend on whoever we are. but the response will be different in that sense now. So if you look at there, you see sadness, sad, afraid. Yes, this, overlaps with all of us wherever we are. Anger, yes. Powerless, yes. Guilty. So some of these will come in different proportion, but sadness, being afraid, and being anxious, these are the three key that overlap. Now, working with youth groups, this is and I want to introduce you to my work right now, specifically here. We worked with 40 groups. So sorry, my spelling of countries there, U is out there. So sorry about that, typo. So we worked with 40 groups in Africa, and I did this with WHO. I was looking at health educational programs and health promotion for 40 different countries. I did that in Addis Ababa, Ethiopia, under the aegis of the WHO Afro-Africa, where I worked in Brazzaville, Congo. Now, we did a survey, and that survey was classifying climate change and mental effects. So we just asked these youth group leaders, how do you see climate? Do you see climate change as a problem? Some of them have varying, concepts about climate change because they don't seem to have some facts really. They look at it as a hoax, as some people will even talk about. But when I try to explain where I'm coming from and what I want to get from them, this is the answers I got, that I had to classify this from getting to listen to them. So eco-stigma is 90% across Africa based on this survey. Eco-anxiety. So this eco-stigma and eco-anxiety, which is for what? How does it come about? Because of poverty, that with prolonged rain, they have to buy medication, so they don't have the money due to poverty. Then, it really messes up the environment. That is, it actually depletes the environmental aesthetics. So if you have floods, it carries plastic bags and plastic bottles all over, deposit them. And then after the rain, you find so much accumulation of plastic bags and bottles in certain areas, really giving a poor vision and poor aesthetics of that particular area. Now, internally displaced people, witches and wizards. They told me witches and wizards, they work very well during rainy season because people are at home. So the witches move, thieves are moving around out at that particular time, because when they go to steal, the rain is falling, nobody's going to hear the sound as they're breaking buildings and things like that. So with prolonged rains, these social problems also occur. That's quite interesting. Now, eco-sadness, stress level 70%. So this is a rough classification. Death, sickness, lack of electricity, water, theft, snakes and rats leave the bushes and then come home because water is carrying these things, these animals from the bushes to homes. And so they invade cities. And that gives you that thought of it is distressful mentally. Depression, psychosis, and then gender-based violence is number 5. So this is what I got from it. So now I made a rough classification here. The prevalent climate change indicators in Africa are what? Based on this, prolonged rains and drought, floods, landslides, and thunderstorms. All right. So I move to the next slide. So this is pictures. Just watch this picture. That's in Cameroon. This occur. This for my area. Landslides with number of deaths here due to prolonged rains. This is in Bafoussam in the western part of Cameroon. Now the picture on the right up, South Africa in Durban, you can see that. And then now at the bottom of the landslide in Cameroon, it affected a toilet. And look at the toilet, that's a latrine that is built there. So you can imagine leaching of this latrine, content to water on the groundwater where people would drink this water along the line, and that's increased water. So the thought of it, it's actually, petrifying, and it's horrendous to when you think about such a thing. And that gives stress on your head, stress on, mental health challenges. So heavy rains lashed the city of Durban with mudslides and, floods in incessant rain have triggered floods in the eastern coastal area and province. South Africa, April flood. So you see that picture there. It's a big problem. This is in Nigeria. The reality of eco-grief. Floods in Nigeria wasn't food shortage. So you had this in Jigawa State and Taraba State, which is also part of Cameroon, where you have the River Donga and River Mountain, which is actually neighboring the northwest part of Cameroon in the Mambila area there. The floods coming, you get all this in Taraba. Look at the way people stood there, cut off from the other neighboring villages. Those that are from the neighboring villages, they have to spend a night here. So they're internally displaced for a day. So you can imagine the stress mentally. And look at all that, cars trapped left and right. And I'm sure this kind of scenario you will experience in Lagos. Now, look at that, birds from Chad and Nigeria destroying farmlands, with prolonged droughts and so on and so forth. So these locusts are actually they migrate to areas and destroy farmland. Now, the picture on the top right, that's in Democratic Republic of Congo Brazzaville. I was there, so this is not just a picture. I was there, and that's along the banks of River Congo, and that destroyed the whole road due to excess flooding from the banks of Congo. Now in Cameroon, look at heavy storms, lightning, destroy the homes, and those people, they are actually homeless. Now the reality of eco-grief. Prolonged heavy rains with thunderstorms destroy cattle in Cameroon, in Kenya. So you can see that. Look at how people stood there in grief and in disarray, wondering, what do we do? That's a source of economic income. Now look at, this is in Cameroon. We've done detailed studies here, and we can discuss this for another lecture, where you find floods in Cameroon destroying farmlands. And the people in one of these villages say that they are no longer having their wild delicacies of mushrooms, which they grew up to eating these mushrooms, but climate change is affecting the ecology of the mushroom, and the mushrooms are not going extinct. So they mention all this, and that's the effect of that. Prolonged rains in Cameroon, creates poor atmospheric conditions for storing their beans. So the fact that the beans is decayed, maize being decayed on the farm, the yield is depleting, that gives them high temperature, high fever. The thought of it affects their mental health, brings in eco-sadness, brings in eco-anxiety. And that's what we have been able to map out this in Cameroon. This is Cameroon in Douala, in the littoral part of Cameroon. In Douala, you see all this excess flood in Douala. So hundreds of homes, this happened just with 2.7 million people living in that particular city. Houses were, broken down, all these waterborne diseases, rats. The thought of it, where you are homeless, where you're going to get a house, and you are in a major city. This kinds of scenario may be happening also in Lagos. So look at that. So temperature-related deaths, so I'm not going to explain this, I've mentioned some part of this. So what I want to say here, and I'd like for us to reflect, is that the mental health issue is all about our brain. How does our brain react to this kind of terrible situation that we are confronted with? It affects the central nervous system because you have the motor neurons in your head. Now, if we're to build intervention, how do we build intervention such that it calms down the motor neuron? So those are things that we need to look at. So there is a biosocial aspect to all this. Now, so this leads us to intervention. So we've looked at the problem. We've looked at the perspective of the problem. How do we build intervention? I told you that we need to build intervention by first understanding this problem. Number two, understanding that the solutions to the problem is actually in disparity. That means the way the Western solution would be may not necessarily be the way Global South would design their solution. That's number two. And so I will settle on the fact that this is due to disparities in the socioeconomic or socioeconomic determinants of these people. These are people on a very high GDP. We are on a low GDP. These are people that have health insurance. These are people that have good governance. We don't have all this in place. So our socioeconomic determinants allow us to design community-driven interventions for attacking, creating climate resilience and bringing, reducing the challenges of mental health. So we launched a project in Cameroon called the Ibanicom Climate Mental Health Literacy Evolution Intervention Project. And that's very interesting. Ibanicom is a village, which means the light of the Com people. And that's my village, the light of the Com people. That's the meaning of Ibanicom. The climate mental health literacy. Because right now at the moment, and I like to challenge you, Susty Vibe, we do not still understand climate change. If I ask you, what is climate in Igbo? What is climate in Yoruba? There's direct word. You will end up trying to translate the word climate to Igbo from English to Igbo, and rather from Igbo to English. And that's where the problem comes. That's number one. That tells us that we are still Western-centric and imperialistic, brainwashed in the way we're looking at that. And that's why I have spent a lot of time working on the African health system. The African health system is different from the European health system. That's why I call the Afrocentric health system that we have. Because in Africa, we have in our tradition before colonialism, before 1884, when the Germans came to divide Africa through the Berlin Conference, we were existing as independent states. We had nothing. The Yoruba was a state. Com was a state. Benin was a state in itself, in equal, in majesty, and in its own right. But when they came now, they put on this, and now we are discussing issues of interventions using the white man's language. And that's where the problem begins. So we need to be conscious of that. And that's why the Urbanicom project consider all these factors to build a project that is resilient in its own right, endogenous from the people to the people and to the world. That is the Urbanicom evolution project. So we got the meaning of climate change in the context of the people, not translating from English to Urbanicom. So you listen to that. Now the project was built on an ecological view on mental health, because we need to spend more time to educate ourselves on what mental health is and what climate change is. We're rushing to talk about intervention, shouting climate change. Most of them are politicians shouting climate change, looking for money, and not looking the existential and the empirical, as well as the epistemic issues to understand first before we start looking for intervention. Also, we have to educate ourselves. When I was talking to the people of ECOM, I realized that I was ignorant about the literacy of climate change, the way they understood it, and mental health, the way they understood it. And then I realized also that I have grown up forgetting my shadow. And I realized that the villagers themselves, many centuries ago and many decades ago, they had a public health specialist, what they call ethno-public health, and they had the ethno-epidemiologist, and they had ethno-biochemist, which was very exciting. So we worked on intra-psychological factors, interpersonal processes, the common being. So we looked at the ethos of the people in their tradition, and then we looked at the institutional factors, community and the ethos, the kingdom, how it was built. And we're looking at the governance. We're designing intervention based on pre-colonial society of Africa. So that is what it is now. And I will just rush through the pictures here. So we build what they call the eco-mental health literacy promotion in community, aim to create health promotion actions, which means create supportive environment. Number one, this is what the project does. Strengthen the community, develop personal skills, reorient health services in that community, build healthy public policy. So all this, we have digital information. So what is the eco-health literacy all about? What is health literacy? The mental health literacy means access to the mental information, the information that is useful. You have to have access to it. 2, understand the information. 3, use the information. 4, benefit from that information. If these 4 pillars are not defined, then you are still mentally illiterate. You are mental illiterate or climate illiterate. So we have to be able to have access to the information, understand the information, use the information, and benefit from the information. Now, the Urbanicom Mental Health Literacy Evolution Project, so we did this. We undertook a ground survey to detail the barriers, the perception, the traditional beliefs. I can talk on this on another symposium. There's a lot about this. Surrounding climate disasters. What is the perception? The people told me the perception of disasters and how do I go in. So we use the elderly in that community, in the COM community, as indicators of change, of how climate has changed. We look people in the 80 years, 90 years, 95 years and above. They told us how that community was, how rainfall pattern were, how the rivers, the streams, the brooks were, and today. So those were our markers, those markers of climate change. They told us, they educated us, and we use those markers to build interventions. So we developed policy briefs. So we compare the perceptions of eco-grief with similar situations in Europe and realize that they're different. America, Africa, Asia, totally different. And so what kind of intervention? So we had to do systematic reviews. So I worked with all the community on WhatsApp groups. Then they got to discuss with their ancestors. How they did it, you don't ask me. They had the ancestral belief to say, hey, look, how do we do this? So we did a meta-analysis. So we have findings on this. So we now came up to realize that we need decentralized intervention strategies that guarantee sustainability for mental health and climate change. So the project, mental health and climate literacy. So I mentioned that those are the characteristics of the project. So we just rushed to the project. We now map out the indigenous knowledge. So let me, through this oration, explain the tenets of the Ibanicum health literacy, the Afrocentric part of it. Now, the indigenous knowledge was built on the philosophy of the people, the Com people, how they were, the kind of food they were eating in those days and today, what they need to do. There were traditional measures in terms of preventing certain diseases, water, where they need to drink water, where they're not supposed to drink water, which stream was good, which stream is not good. They had all these indicators, so we built on that. And then the philosophy of the Com people is on what? The Cha, which is called wine, Afogena, which is called food, Nyamgwin, which is called prosperity. That is the three philosophies. So we built our mental health literacy and climate change literacy built on that. So 99% of the men complain about stress nowadays, which was not inexistent in their days. Thinking with headaches. The young married men are now with hypertension, which they were not having it in their days. And that gender-based violence is more today than in their days, but that they had gender co-wars in those days. So we provided a model. 90% of women have mental issues because of what? Food, drying of crops because of heavy rains and all that, blah, blah, blah. So all these things, we now came up with a model that provides the guidelines for reversing this situation. And they build that model together with us. So it's a co-evolved model. So the organizations invited here were the allied health practitioners from that village, the king, the traditional government, the state government, the health officials and professionals, the kingmakers, the teachers, religious organizations, academia, NGOs, the ancestors. Do Chong means the people, the people is like the legislative, the traditional legislative arm of the government. And then we had the judicial, traditional judicial arm of the government for implementing law. So we brought them all into perspective to draw this. Now, this is the nitty-gritty of it. This is the crux or the crescendo of my talk here and now. And from here, I'm going to end my talk. What we did here was that in most African tradition, you hear about the leopard back. The leopard is one of these very strong animals in the forest. Now, if you see the kings in Africa, they sit on their seat, covered with the leopard, back. If you look at that, look at what is in front of you. So hunting a leopard is a prestigious thing in Africa. And in my village, when you hunt a leopard, they give you a title, which is called the champion of the leopard with 4 legs. That's what they give you. And it's a rare event. And when you catch a leopard, you have to bring it to the kingdom. You can never, and on no occasion, eat a leopard. You have to bring it to the kingdom. And the king would crown you, and then they would start to dissect the leopard, distribute it to people, and then they will give you that title. Now, over the years, we realized that the leopard population in the virgin forest in Com is actually been depleting. And that's an indicator of climate change. They also mentioned that. And now they said, but now it's very difficult for their sons and daughters to catch leopard any longer because it's very Herculean task and the population is depleting. So on coming with this project, I now came with a title called the digital leopard. That means if we continue this way, that means several generations to come, they may never have a leopard. So what happens with this ritual exercise that we have? In hunting leopard. So I came with a leopard called 5 legs, which is the educational health promotion leopard. And I introduced it to the kingdom. And then they took time and they studied it and the ancestors approved it. And now they call it the mental climate health literacy leopard with the 5 legs. And so they crowned me as a champion of the leopard with the 5 legs to bring in health promotion. That means henceforth nowadays we don't need to go and hunt down the leopard. Let them allow them to grow. We now have a new leopard, which is mental health, climate change, health literacy and promotion for the Com people, which is a new leopard. So if you bring in the package of education, they will crown you as the champion and no longer going to hunt down leopards because it's affecting the climate, it's affecting the ecology and all that stuff. And that was it. So look at it now. So that's the official launching of the project, blessed by the ancestors. Now, that's the palace now. If you look at the picture there, the Banicom Mental Health and Climate Literacy Evolution Traditional Policy Model. So it's a new policy that we are supposed to have. One, We don't deposit things in the water. We don't hunt down our leopards. We don't eat leopards. If we have them, fine. If we don't have them, so we brought in different projects in lieu of leopard meat. So we brought in a mushroom cultivation project. We brought in, some good projects to preserve tomatoes, preserve, all these crops that normally are being affected by prolonged climate change, humidity. We educate them on that particular end, in order to, cut down the effects of the climate change, which inversely or invariably cuts down the effect on mental health. So that's the king himself crowning me on this for the bringing in the new educational leopard, which is the first of its kind in the whole kingdom and in the whole ancestral history, that education is changing the traditional law, changing the traditional norms, and they are now keying now to a digital leopard. That is exactly, which is now challenging and solving mental health and climate change issues now in the village. So this is the Ebanikon mental health and climate literacy evolution. We call it evolution because it's still evolving. So we realized that after getting to 1 year, it has spread down to all the sons and daughters and kindreds in diaspora all over the world, and the fund gave it as a policy. It went on all social media groups, it went on all radio stations, it went on all the indigenous language groups, and now the traditional judiciary and legislation has enacted that law now, and it's become a policy for mitigating climate change, mental health issues for the common people, and that is clear. And we have the micro projects that support that, because if we don't put the micro project, then we are not being able to address the socioeconomic determinants. That's the Afrocentric approach. So by this 1 year evaluation, we are seeing stress reduction, increase in social cohesion. We have the barometers for measuring this: reunion with ancestors and succor and hope in living, reduction in trauma, happiness. People say, well, whatever climate change is occurring, that's not an issue. This is the way we're addressing it. We are happy. Conservation, sustenance and curtailment of harmful farming practices, hunting and poaching reduced now, buildings, whatever, we have the structures for addressing that. Anger due to loss of properties and reduced. So there's a community scheme to deal with that, deal with loss of property, deal with internal displacement and things like that due to climate change and all that. The king has enacted that. So for me to end, this is one of the things. So I put up a water project in the village using moringa sand filters to treat the water. That is it on the picture there, to say that if there's too much flooding and water is polluted, when you take it, just put in a sand filter at your home and treat the water. Moringa is there, the sand filter is there. That is the interventions. Not just telling them, okay, climate change, water, okay, climate change is occurring, floods are occurring, you can't do anything. If you tell them, if you give away a good weather forecast, okay, there's prolonged rains and all that, people prepare, carry your bags and put there. You're not solving their problems. The effect is still going to be there. So these are the challenges there. So we have provided some little minor technologies and training to support that. That calls for eco-resilience. That is the meaning of eco-resilience, okay? So, and we're doing that. These are some of the projects. I gave a lecture just last week to South America on some of these, to Bolivia and Mexico, which is environmental assessment management for development plans, programs, and projects. I gave a lecture on that. And then you can see from that, I'm also doing one for Nigeria in Imo State. And so this is the structure of the Barnicom project, the stakeholders, the steering committee, the health literacy partnership. There's the pillar for you to be able to go. And I read something here. Pache was arrested for fighting climate change with the wrong trees. I read this thing and I was so amazed from social media. You don't fight climate change with the wrong approach. That's just the whole thing. And those are some tools and materials that we can use. We can still talk about this in detail. Thank you. That's the kingdom, of COM. And that is the crowning of the eco climate mental change resilient Ibanicom project. That's the king there. So I'd like to thank you. And I said, this is an ongoing project topic, and there are so many things. We can have more discussions in another day. Thank you very much. Okay, I appreciate all of you and I appreciate your time. Thank you.
Thank you. Thank you so much, Professor Kenneth. This has been so eye-opening, and it's just interesting to see that not just do we have this in Africa, there are people who are benefiting every day. There's something you said that was really, really profound. And I think I've also thought around this line in the past. People often ask, how do we solve, or how do we what's the intervention for eco-anxiety, climate change, and mental health issues. And just as you've just demonstrated, the fix is to fix the impact of climate change, literally. So provide people with local interventions and solutions that would minimize the impact of climate change on them, like looking at what you're doing with water. And I think looking at it from a very Afrocentric perspective, where you're not bringing anything Western. It's literally for the people, by the people. It's really interesting. I'm seeing lots of people chatting, saying that they've had they've learned so much. It's been enlightening. One word I see coming up a lot is insightful. So absolutely, eye-opening for us, to see this happening in Africa and to see that this can be done. It's very, very clear that, this can be replicated in different communities using this model. So I definitely want to reach out to you some more, to even learn about what you've done with this community in Cameroon. In terms of questions, I do have one, and I think we have time for an extra one. I see that Ayo on the group has asked if you could describe what you meant by a meta-analysis and how we can also use it for our own research for people who are engaged in climate change and mental health research. So that's one question. And then my question, well, I had several questions that I'll have to message you on. My own question was, you talked about the community knowing what climate change meant, how you worked with elders and whatnot. I wanted to ask if they knew what climate resilience meant. Is it something that, that was already established? Because there's been a lot of debate on what do we really mean by resilience and adaptation when it comes to climate change conversation. Is it something these communities already know, or is it something that has to be, shared to them, taught to them and whatnot? So wanted to get your feedback on that question. Thank you.
Okay, thank you. Very quickly, I think it's such a symposium is where you have one lecture or one lecturer is more or less participatory. We ask so many questions so we can discuss because we want to learn. All of us. I'm also learning, by the way. So I want to thank you for that, for giving that opportunity once more. When we say meta-analysis in public health, you have to do a very high precision analysis. High precision. They call it high precision. Precision in the sense that you have to compare a lot of work that has been done in that area. In fact, all, if possible. That's called meta. You bring all the works together and then you compare them statistically. You take the conclusion of every work all together, put them onto a statistical chart, either SPSS, or either you look at Duncan multiple test, or you look at other tests like ANOVA, whatever, and analyze to see to which direction is all these works, all these reported works converge. What are these work? Are they saying the same thing? What are the differences between the authors? What their conclusions are? What are the differences in their conclusion? That's what is called meta-analysis. And it's lacking in our research. Even the students, I notice I'm mentoring young lecturers in the university, and my colleagues, they still have to go back to drawing board to learn how to do systematic and meta-analysis. I've been teaching this particular. My professors, some of them don't know meta-analysis to do. Everybody seems to be in a rush, and Africans are in a rush. Thank you. So I leave that part. We can talk about that. We can train people about meta-analysis, systematic reviews, scooping reviews, and analyze. When you get the results, then you can use it for a policy implementation. You can build interventions based on that. That is what we did. Now, resilience and adaptation. These words were existing now. They were existing time immemorial. The villages had their own words. This resilience and adaptation is what we call the Hausas called Turanci. It's English now. It's an English thing. But in Yoruba, they have their own connotation for it. But don't make the mistake to go and translate it from English to Yoruba. Then you realize that the meaning will become diluted. Or in Igbo, it will become diluted. Go back up initio to ask people that how is this describe the act.
then they would use the words. Okay, the language will come in. So when I went to the village, I realized that they have resilience already. They have adaptation already in their own language, in their own dictum, and they are there to take that evaluation of resilience and adaptation, also teach the West. Thank you. So it is in existence.
Thank you very much, sir. We've gone a bit over time, but this has been so insightful. I know for sure we're going to invite you again. We want to do so much more with you. At TEAP, we're about to start a pilot study, even looking at elders who are based in Lagos. So very much in line with the conversation of asking questions, having dialogue, creating spaces for conversation. So that's a project we're about to start, just now recruiting participants, people from different parts of Lagos. Thank you again. I see Shilot says, it gives me so much hope to hear another African bringing the importance of indigenous knowledge that the older people already know. Thank you again. Hope says Africa is still very primitive, and these communities, regardless of their strata, still experience climate change. It's important to view from their own point of view. Absolutely, Hope. Everything we've learned from Prof today has really described how it's important to go back to communities, look at indigenous knowledge, and don't just assume that we don't know anything about climate change and we have to be taught. So advocacy has to go both ways, we learning and also the communities learning from us. Our next TEAP webinar would be August 22nd. So we're going to share an invite to everyone here. We're going to be looking at intergenerational wisdom when it comes to coping with climate change and mental health conversation. So we would have two elders, who are also advanced in age and have been focused on environmental issues at community level, who will be speaking to us from their experience. So we're very much in line with, Prof's recommendations and model on how to look at this topic and how to address it. Again, thank you all so much for, coming to be with us, spending this hour with us, learning something about, climate mental health resilience. Our gratitude goes to you, Prof, for spending time, literally volunteering for us with our experiment and ensuring that you're able to transfer knowledge to all of the young people and enthusiasts who have come to this webinar today. We're going to share the recording with all, share on social media, so more and more people get to learn and get to see, this really interesting and insightful conversation you've offered us. Thank you again, and thanks again, everyone. Do have a pleasant rest of day. Thank you.
Thank you. Thank you. Bye-bye.
All right. Bye.
Thank you. Bye, everyone.
Bye. Bye.
Bye, everyone. Thank you, Prof. Kenneth.
Thank you.